We thank God Almighty for His mercies and grace over all of us. Indeed, with Him, all things are and have been made possible. My job here is simple, which is to welcome all dignitaries, participants, press, and other invited guests to this symposium. I'm most delighted to welcome you all to this very important one-day national symposium on assessment of Western policy against COVID-19, which I believe our keynote speaker and our guest speaker will do justice to that. It is also my pleasure to have you all present in this epoch-making event. This gathering is an indication of our readiness in joining hands with the rest of the world, both the world leaders and the government of Nigeria, to move the country forward. One may ask, why the symposium? The answer is simply thus. We are here to review COVID-19 pandemic and its resultant impacts on the economy, on the citizens, and the entire nations of the world. We hope that great lessons have been learned from the pandemic moving forward. We are also here to forecast and project future remedies for emerging viruses like monkeypox, hepatitis that are now ravaging the world. Distinguished ladies and gentlemen, we are passionately advocate that all stakeholders, international bodies, agencies, private institutions, and practitioners in Nigeria should endeavor to come together to support the government in providing great remedies to curb the emerging viruses and disease. Our organization, in collaboration with CIDA and so many other developing partners, is hereby makes this clear call, urging all relevant agencies of government in Nigeria and beyond to be proactive towards developing fast remedies against foreseeable pandemic of monkeypox and hepatitis. If you look at the way COVID-19 ravaged the world, you will know that it is better for us to be proactive.
The topics for today's discussion are very important. Those are public health issues that, when prevented, surely they will definitely stop or ameliorate or prevent the consequences that come with it, whether it is morbidity or the mortality that comes with it. We all know about what COVID-19 did to Nigeria and Nigerians and the whole world. And that is why today we're here seated to learn from international best practices and local practices. What did we do wrong? What did we do right? What are the gaps? What are the challenges? What are the recommendations? And what are we forward? We're not praying for Nigeria to have such a pandemic any longer. But in the events of what next, what happened, we should be prepared. And it is on that basis that these brilliant intellectual speakers are pulled together to come and give us such. If you also look at issues of hepatitis B is one of the highest diseases that have one of the highest morbidity and mortality. In fact, an average clinician will tell you that he would prefer to manage a patient with HIV than to manage a patient with hepatitis B because of the fatality nature of hepatitis B.
It's more dangerous than COVID-19. And the way and manner that we are just too silent about it is what that gives us concern. Because this thing really affects more younger generations, which is the youth. And that is the demographic that we are representing. And we felt that it is necessary for us to commence an awareness and sensitization campaign whereby we can be able to get more people to be aware about this viral disease, to see how we can also be able to collaborate with government and get prepared for this disease that is likely killing millions of people. And even the danger of it is that most of it are not curable. You can only start preventing it And from the lecture, you realize that the moment when it is struck, the cure is not even up to 50%. So it really shows that we need to create more awareness to it, let people get to know, let people get tested, let people get to know that there is vaccination, there is a whole lot of package that can reduce the rate of deaths with these three diseases. They lack free access to medical facilities, but to be honest, sensitization is key. Even me, I'm telling you now that so many people are here, they are not even aware that there's a vaccination for hepatitis B. So it tells you that people are not even aware. So awareness campaign sensitization is even the most key important, because but we will continue to be advocating for government to strengthen.
And some of the ways we can bring this to a manageable level is to always get involved in our campaign. Most especially, a lot of youth feel that you cannot carry out a campaign when you are not a health practitioner. But a campaign shouldn't only be carried out by a health practitioner. This is our country. This is we, the youth, who are energized. In our various workplaces, we can make this happen. Even in our gathering, in our restaurants, where we eat, in our schools, in our workplaces, we can speak to people about this, and you never can tell that you will be saving a lot of lives.
Minimum restricted. So, what Nigerian youths can do is become like agents of education to let everyone know about the existence of monkeypox, and also individually look out for possible cases of monkeypox. The most distinguishing symptom of monkeypox is the rash, which develops in individuals that are infected.
We have listened to some resource persons who were here to speak on the theme of this conference, this symposium, assessing Western policies and how it affects us as a country, Nigeria, and have brought in experts to speak to the team, from monkeypox to hepatitis and to COVID. We've seen what our government has done. We've seen what other governments have also done. And we are borrowing a leaf from what has been done in other countries to see how we can improve on ours in terms of strategy, in terms of frameworks, and in terms of sustaining the response to COVID-19.